Everyone, and welcome back to the Osteo Physio YouTube channel. Today we're going to be looking at why am I getting pain around the back of my knee. So lots of individuals come into clinic and they start presenting or suggesting that they're getting pain around the back of the knee, so they're kind of pressing around the back, around where the hamstrings and the calf muscles attach and blend. There's lots of different conditions that can trigger soreness into this area. So number one, we're thinking about any referral from the hamstring muscles. So your hamstring muscles are the large muscles around the back of the leg. They are absolutely vital in bending the knee and adding support regarding the posterior chain when you're moving or doing any type of exercise. So a condition that can cause a lot of soreness around the back of the knee is any damage to the tendons of the hamstrings as they blend around the back. So it's either going to be your biceps femoris on the outer part of the knee, or your semimem or semitendinosus tendons as they blend on the inner part of the knee. So if someone's done excessive sport, for example football or high impact sport, where you're firing through the hamstrings, not only can you get pain deep within the belly of the muscle, but you can start to get pain and inflammation down into the tendons, which causes and triggers pain around the back of the knee. The reason why this is so vital is we want to look at, has this person changed their frequency, intensity or duration of their sport? So these are three really common triggers that can cause potentially inflammation or micro trauma into the tendons of the hamstrings. So when we're thinking about management for that person, we want to look at, okay, what has triggered this, what's been going on, what can we influence to help long-term positive outcomes. So can we get them rebuilding their training slowly? Treatment wise, can we help to promote recovery into the tendon, so encouraging blood flow and relaxation into the muscle belly, but also looking at the mechanics between the knee and the hip due to the attachments of the hamstrings. So attaching behind the knee, obviously triggering the pain through there, but also actually attach up into your ischial tuberosity or sitting bone. So if the hip is in a slightly abnormal position, that's going to be impacting the knee function as well. Another condition that can trigger or cause pain around the back of the knee is actually involving your calf muscle. So a lot of people don't realise that your Gastronemius muscle actually blends above the knee, so it doesn't stop in the lower part of the leg. This is absolutely key for plantar flexion, so lifting up through the ankle and through support, but also adding to that posterior chain of support when doing any kind of physical activity. So same as with the tendon activation, if you've suddenly changed your sport in terms of frequency, duration or intensity, and you're not stretching and releasing the calf, what can happen is myalgia, so muscle pain can form in the belly of the muscle. It can start to tighten and pull on its attachments. So what you can start to find is that you'll have local pain or pressure potentially into the lower part of the leg, into the calf, that can also pull or aggravate higher above into the knee. So what we would want to look at is, how is that calf functioning? Is there any aggravation into the Achilles tendon, so where the calf blends and attaches lower? Could that tightness be impacting the attachment up behind the knee? So we'd want to get all of that moving, releasing, stretching through there, but also making sure if you are doing high impact sport that you are releasing into your calf muscle in terms of stretching, potentially foam rolling, or trigger point releasing in terms of using a tennis ball to release the pressure from the belly of the muscle to reduce the referral up into the back of the knee. Number three, we're going to be thinking about the popliteus muscle. The popliteus muscle is a tiny muscle around the back of the knee, absolutely vital for stability of the knee. It externally rotates the femur on a straight leg, so when we're loading with the ground. So what it does, it helps with this open chain mechanism of rotating the knee as we're moving along, so improving how we're walking, but also improving stabilization of the knee with any high impact sport. So what's really common and what we see if people are presenting with pain around this muscle, where it's attaching from the femur, so the big bone at the top, blending to the aponeurosis with the lateral meniscus, what we find if they've changed their sport, where suddenly they've changed the amount of duration, the frequency or the high impact of the sport, and they're doing a lot more loading into the knee, what can start to happen is trigger soreness around the back of the leg, and it's normally at an oblique angle when they're pushing and palpating, and it just feels really, really bruised and tender around the back of the knee. So first of all, we'd want to look at palpating locally to see if we can help release or at least flush out any tightness when we're looking at the hamstrings and the calf and the movement around the back. We also want to look at how that person is walking. So if they've changed their mechanism of walking and they're putting more pressure on different parts, potentially around the front of the knee, it's going to be absolutely disrupting that balance between the front and the back of the knee mechanics. So although the pain's around the back of the knee, we want to be looking around the front. We want to see, can we release through the quadriceps, improve that patellofemoral joint movement and the normal knee function? Can we help to restabilize through the knee? So again, strengthening exercises to take the pressure off the back of the knee to allow that popliteus muscle to recover, so it can then do its job in terms of stabilization through the joints. So we'd be looking at all the mechanics around that area, as well as optimal movement through the hip, knee and ankle to help when that person is participating in their sport.